Hello everyone, Namaskar. Welcome to Adi Shakti's first exclusive talk show, Gupshup. So before we start, we'll request you to put your questions that it was requested earlier onto the chat box, and we have the whole team looking into the chat box, and the Dr. Anirban Ghosh, who is our speaker today, will be able to answer your questions. So as most of you might have already seen, and perhaps even know, that through Gupshup, we are trying to reach audiences across borders with short, meaningful, and inspiring talks. These talks are mainly aimed at dispensing authentic information around vital aspects of life, most of which are now in flux because of the unforeseen epidemic that we all are enduring. We have hence invited some speakers who are well respected in their own field of work and can speak in forums like this to enlighten us with their idea and suggestions. Today is the first of many such gupshups. We will be bringing you talks every Saturday till 23rd of May, and it gives me immense pleasure to introduce Dr. Anirban Ghosh as one of our first speakers. As our first speaker. Dr. Ghosh is one of the frontline heroes of today's world, one of those who are providing support to us first, and then, if time permits, taking care of their own families. Working as a doctor for the NHS, I am sure Dr. Ghosh will be able to provide us with some very important information about the medical realities of our time, along with experimental advice around how to navigate what we know about COVID-19. So besides that, Dr. Ghosh is not only a medical professional, but a very well-known author, if many of you know already. One of his books has received the bestseller award in one of the esteemed Indian publishing market. He is also a part of a very enchanting group of people who write interesting blogs, and that's called Anari Minds. And most importantly, Dr. Ghosh is a wonderful person whom I have the privilege of calling a friend. Having said this, I will not take more time and allow Dr. Ghosh to crack on and enlighten us with his talk. Over to you, Dr. Ghosh.
Thanks a lot, Parthoda. As Parthoda said, my name is Anirban. I'm a doctor. I'm working in NHS as a bariatric surgeon presently. I would like to thank Adi Shakti to let me speak here today and talk to you guys. So what I've been asked to do today is try to talk to you about this current pandemic that we are going through, this COVID-19 thing, and share my understanding and knowledge with you. And I would not say to guide you, but to say what my experience is that I can tell you. So before I start, I must say that I got exposed to a COVID positive patient whom I saw last Sunday, and he didn't have any typical symptoms at that time, and then he started showing symptoms, and he got himself positive on Thursday. So I just had my swab checked like half an hour ago in the hospital. So I'm not sure. I'm waiting for the result to come back. Hopefully within the next 3 days, I'll be able to find out whether I've got the positive test or not. But I can assure you that through this web chat, none of you are going to contract the disease from me. You might think of it as a lame joke, but the truth is that there are quite a few rumors going on around. And there is a new university called WhatsApp University, where you would get new data and research papers and new things coming up, must be coming up into your mobile, saying the COVID-19 can spread like this, that. Even one of my friend was telling me today that somebody has contracted COVID-19 while speaking to someone over phone who has got the disease. All of us know that it doesn't make any sense. So what is it exactly? So if I want to tell you about the ABCD of the disease, I do not think at this point of time there is no point of doing so, because we have been seeing this for about last 2 or 3 months, and we know by now that where from it has originated and how it has progressed so far, and what has been going on around the world to deal with it. very basic things first, that it is one of the viruses. Its brothers and sisters has been there in this world for like millions of years. And like there is one disease called SARS, which happened a few years ago in our own earth. And this is a new progeny of this those generation of viruses, which is a kind of a new to us, because that the DNA of the virus is a bit different than the others. Now we know what it is exactly. And the thing that we don't know or don't understand fully yet is how the disease is spreading. For now, we know for sure that it is spreading through human to human contact, uh, like mostly through body fluids. Like if somebody sneezes in front of you or coughs in front of you, or if you come in touch with a body fluid too, so it's somebody, and if it comes in contact with your mucous membrane, that means inside your mouth or your eyes or your nose, probably there is a high chance of you getting the disease. That's one of the way of transmission. There are quite a few other ways of transmission. I do not want to talk about them now because they are not well established, and I do not want to confuse you people. For now, we should concentrate on only this, and we should try to find out ways to prevent it. I'm not sure how many people from which countries have already joined us. As we are speaking today, I have been looking at this website, worldometer.info. I guess all of us knows about this website. This is not an authentic one, I must say, but few people has taken their time off and doing this voluntary work, which is phenomenal for us. And basically what it is doing is showing up the current statistics and tallies about the disease throughout the world. As we can see here, that about 3 million of world population is currently currently polluted with the disease, and we have lost about 200,000 people, unfortunately. So whenever we talk about a disease, we think about one question first: whether it's going to kill me or not. In medical term, we call it mortality. So what is the mortality of COVID-19? It is kind of a range. I mean, till now, it is ranging around 2% to 7%. In a few countries, it is about 10 or 11%. But since we do not have all the data of the people who are infected, and people are getting more and more infected with the disease, so the mortality rate, the exact mortality rate are still quite unsure. I can assure you this, that whatever the mortality rate you are seeing today, if we look back into it in about a year time, it will be definitely very, very low. But what it is what it is now. So I would say about 4 to 5% will be dying out of 100 while having the disease. And why they would die? So COVID-19 is the name of the disease, as all of us know, and the name of the virus is SARS-CoV-2. So how I've told you how it spreads. Then what happens is once it gets into your body, the basic tendency of a virus is it always try to multiplicate itself and creates his own sons and daughters, and they will keep on multiplicating themselves into lakhs, millions, and they will go all over around your body. And at that time, what happens? Body recognizes it as a foreign element, and body try to act against it, try to kill it. Unfortunately, sometimes in the process of killing, what happens? A few of the body's own tissue get sacrificed, and that is most of the time is the cause of death. Like in case of SARS-CoV-2, it will go into your lung. Your body will suspect it as something that doesn't belong to the body itself. So the body will think that I must kill it. But in the process of killing it, it will also kill the tissue of the lung. And thus, it will create a disease in the lung itself. We call it ARDS, that is an adult respiratory distress syndrome. What does it mean basically is you will have less and less lung capacity to breathe. So our lung basically helps us in breathing and exchange of oxygen and carbon dioxide. So if your lung is not working at its full capacity, that means your body is not getting enough oxygen. And unfortunately, if most of the lung is gone because it is destroyed, unfortunately, we would lose the patient then. I do not want you to worry about this spectrum of the disease though a lot, because what we have been seeing so far is that mostly the patients who have multiple comorbidities, that means who are suffering from many diseases like diabetes, some heart condition like hypertension, or the patients with low immuno, patients who are immunocompromised, like patients who have got cancer, unfortunately, who are on chemotherapy, who have been very, very mal nourished for a long time. They are the one, they are mostly, they are the victims of the disease because their body doesn't have much capacity to fight the virus and kill it at its early stage. But at the same time, I would warn you always not to contract the disease by yourself. What's the reason behind it? So mortality is something that we always worry about. The thing that we do not worry about is the morbidity. That means the suffering out of the disease. So even if you do not die, when you'll have the virus, you'd suffer a lot. I can tell you, I've been seeing patients like these and they are suffering quite a lot. First of all, it was most of the time, it will start off with like a malaise and a body ache. That means you will feel like that, oh, I do not want to get up from the bed. Somebody has beaten me thoroughly. And you'll be very, very thirsty. You'll have a very sore throat. You'll have an intense headache probably. And then will come the fever. And then you will lose your taste sensation. Quite a few people has already told to us that they have lost the taste sensation completely. And even when they have got cured from the disease, the taste sensation is always the last to come back to normalcy. And that takes a few weeks. So as you can understand that it takes a long time uh, for the disease to, it takes a long time to recover from the disease. And on the other hand, even if you survive from the disease, think about your parents or your other family friends who might be having a heart condition, a diabetes. You would be okay with the disease having within yourself, but you will be giving the disease, the virus to someone else and who might die. Then rest of your life, you might feel responsible for this, which is not a very good feeling. For that, what you need to do is you need to stay at home. That's the most important medicine that I can prescribe you now. Most of you know that staying at home, being in lockdown means staying at home. It is a very clear-cut direction in black and white. You should not go outside unless there is a dire need. Like if you think that, oh, I'm fancy some chicken, so I would go out and buy it. No, you cannot do that. If you think that, okay, I need to buy some sweets, I need to go outside. No, you can't do that. You need to see a few friends. You can't do that. You can only go out when there is a medical emergency or when your basic foods like your rice, your wheat, or your basic stuffs like your dal is getting scarce and scarce, and you don't have it anymore. You must have to go to the shop, then only you go. A few of you might tell me or ask me that even if I go outside once a week, what max could happen? That how much is the chance of me getting the disease? Let me tell you this. There is something called R0 for every virus, which means that how many will get the disease from a patient who has COVID-19. The R0 for coronavirus is 2 to 3. That means if I have the disease, at one point of contact, I can give the disease to 3 of the people. Like, so in a shopping mall, if there is 100 person in the shopping mall and only 2 of them have the disease, so with their each contact, they're giving the disease to 3. And that will only extrapolate in the number. So it will grow exponentially. So if you spend in that shopping mall about an hour browsing through the stuffs, there's a very, very high chance that you might contract the disease, unfortunately. So to reduce the chance for yourself, you must contain yourself within the home. A few might ask me that what would be the treatment so far? First of all, in my in United Kingdom, the disease is being treated at the very basic level. When somebody has a very mild symptoms, it is being treated as a flu, common flu. Like you need to drink a lot of water. For the temperature, you need to take paracetamol and take rest. That's it. That's the only advice that I will give you. And believe me, most of you will get better with paracetamol and water only. There are quite a few medicines that are going around in the news and again in WhatsApp and stuff, claiming that they might work for the disease. Unfortunately, uh, there is not a very good evidence for them. One of the medicine is, I didn't want to speak about it, but I think this is the right time for me to utter the word. It is the hydroxychloroquine. So a few weeks ago, all of us noticed that US FDA approved the drug hydroxychloroquine for the treatment of COVID-19 patients. Then what happened is India government uh, passed out a mandate to the healthcare staffs saying that hydroxychloroquine might prevent the disease as well for the healthcare staffs. And people have been hoarding the medicine from the medicine shop and eating them like their staples every day. What I warned them is hydroxychloroquine has its own side effects. If you have a heart disease or if your heart is weak, which you are not aware of, if you take hydroxychloroquine, it will make your heart act very weirdly. So your heart will skip a few beats. In medical terms, we call it arrhythmia. I can tell you this is not a very good thing for you. People have been dying not because of COVID-19, but because they're taking hydroxychloroquine. And about 3 days ago, there has been a new paper which has highlighted that hydroxychloroquine should not be the treatment of choice of COVID-19, unfortunately. I do not want to get into any politics of it or not. I can only talk to you as a doctor. I can tell you that there is no foolproof medical evidence yet which can say that the hydroxychloroquine can work. So hopefully I have given you something in a nutshell. So I will take your questions if you have any.
Okay, we'll transfer the questions to you now, Dr. Ghosh. Thank you so much for your talk. Shomata, can you transfer the questions to Dr. Ghosh?
Sure, I'm doing that as we
Sure.
speak. Actually, there are 3 questions already which I have shared with you. If you can start with that, and then, yeah.
Okay, lovely. So I had a few questions here already with me. Which first thing is a very pertinent topic. It says what's the reality about the vaccine from Oxford University? The future is very promising. Let me tell you this. So since last Thursday, Oxford University has created a new vaccine which has passed the very basic trials, and now it has gone into a human trial. So they have started doing something called a double-blinded control study, which means they have recruited about around 500 people, and their aim is to recruit 5,000 more people in next few months. And about half of them will receive the vaccine, and half of them will only receive a vaccine against meningitis. And then the researchers are aiming to see that whether the volunteers who had the vaccines will or will not get the disease in next few months, because COVID-19 pandemic is not going to get over within next 1 or 2 months. It's going to stay here. So if this vaccine proves to be effective, then I guess within about 12 months or 18 months, we will get a foolproof vaccine dispensed to all of us throughout the world, and probably world will get better. Next question was, is it proved corona will kill higher natural temperature and humidity? That is one of the other rumor that was spread mostly from Bangladesh, and there was a video that was making rounds, and unfortunately even at that time there was no paper which claimed that coronavirus will die with increased humidity and temperature. I guess this is well proven now, because in my motherland, India, the humidity is quite high, the temperature is quite high. Even then people are dying out of the disease. Even then people are contracting the disease each and every day. What might happen is, with increased amount of temperature and humidity, the virus might lose its virulence. That means it might not be as effective or as aggressive. But do not think that the virus is going to die because of the temperature or humidity. Next question is how long it is to stay at world. Unfortunately, it is here to stay. Think of COVID-19 as your day-to-day life from now on. Even if we win this battle this time, there is a chance that within a few months, we might see another surge of the same disease coming back, or each year we might see one of the tsunamis of COVID-19 plaguing our life. But one should not be worried about it, because by that time we'll have vaccine, we will have the treatment of options, we would know how it works, we would know how to prevent it. Think of it as a flu. Common flu comes every year. And even every year, most of us don't know that common flu changes its DNA. It mutates every year. But so now that we know that it mutates, we have created a new vaccine each year against common flu, and which has saved millions of lives. So coronavirus is going to be a part of the world for rest of the world, rest of this time, but we can deal with it once we get over this pandemic. I had a few more questions from Shomoda. Let me have a look at it. So, hi doctor, normal issues have been raised with age and comorbidity. However, if someone is in early 30s but having type 1 diabetes, do you suggest the issue is equally severe as an elderly? Unfortunately, yes. When I talk about comorbidities, I do not consider age as a factor. Even if there is someone with the age of 6 with diabetes and someone with the age of 90 with diabetes, the severity of them of having COVID-19 disease is equal, unfortunately, and they are always at risk. So look after themselves and take care of them. Do not let them go outside. Try to keep them away from strangers. That's the best way you can prevent it. And if somebody with diabetes contract the disease, I'm not saying that they will die. Like I said, only 7% out of 100 are dying. So 93 of them are recovering from the disease, even if they have diabetes, even if they have going through chemotherapy, they're immunocompromised. In case you have the disease, talk to your doctor, let your doctor handle it. Your doctor is the best person to deal with that. Someone has asked me about a breathing exercise. Unfortunately, there is no such thing. Any breathing exercise is not going to help you. What I can tell you that if you smoke, stop smoking. If you think that I do not smoke, but I vape, stop vaping, because it is as bad as smoking. If you have anybody in your family who smokes, ask him to stop smoking, but because that affects you as well. So whatever will decrease your lung capacity, you must stop that. But there is no such exercise that can help you, unfortunately. Is it airborne? Okay. It's very difficult to answer this question. For common people, I would say, think of it as a disease that will spread when you are coming in contact with someone who is near, like about a meter closer to you. What happened in New England Journal of Medicine, they published a paper saying that COVID-19 might spread through aerosols. Most of the common people do not know the meaning of aerosol, so then the rumor got spread through this, and now people think that it is an airborne disease. Unfortunately, it is not proven yet. Aerosol means small water particles in which the virus lives. Aerosol only generates when there is a high temperature. Like if I'm being a surgeon, if I'm doing an operation, and if I'm burning a tissue, then the aerosol appears, and that put me at risk. That's why whenever I operate on a patient, I always operate on the patient on PPE E3, the protective equipment thing. But for you guys, you do not think of it as an airborne. If you have AC, air conditioning at your home, you can jolly well use it. You are not going to get the disease, as long as you are staying in the home. Each and every time I will tell you the same thing: stay at home, stay at home. Okay. Shomoda, can you please tell us all the steps we need to take step by step when we re-enter the house? That I can tell you what I'm doing. So when I'm inside my house, my wife is the boss, so I follow her advice. So what I do is I get into the house and I keep whatever I have got from the grocery. at one side. Then I change all of my dresses, get into a towel, and put my dresses in a tub, and take it straight to the bathroom, the toilet. Before I do that, I use alcohol wipes to wipe all the stuffs that I have brought from outside, and then I take a shower with soap and water, and then I clean my shirts and the garments that I was wearing same ways, like with soap and water. I did the same like half an hour ago. Like I said that I had test done today, so I had to go outside to the hospital. I guess Shomoda has sent me another question.
Yeah, there are a couple of more questions, maybe just because we are already almost on the hour. I'll read that out for you. So one question which popped up is, can we get COVID-19 from packages and letters?
Again, a very difficult question, but for now, let's us assume that you can get the disease, because there was one of the papers which suggested that coronavirus can live on the surface of cardboards and papers for about 3 to 4 hours. If you're getting a letter, try not to touch it. Leave it there where it has been dropped for about 4 or 5 hours, then touch it. I can assure you, if you do that, you'll be fine. And if you get a package from outside, then clean the package, the outside of the package, the covering of it very clearly with alcohol wipes, and it should be fine.
I think we'll have time for one more question before I hand it over back to Partho. So the last question which has come in is, how much necessary is it to wear a mask in public? I think this is a question which has been going on for quite some time now in the media as well.
That's a den of controversy.
Yeah.
The last question is the biggest question. I mean, it is very difficult to address the elephant. If you ask me as a doctor, if you ask me personally, there is no medical evidence yet of wearing a mask for common people, because what happens that we are not used to wearing masks. I'm a surgeon for last 10 years, so I'm used to wearing masks. So mask has become a part of my body. I don't realize even that I'm wearing a mask. But if you are not used to wearing a mask, what would happen? It will keep on irritating you, and you will feel like a small itching sensation around your face, and you will keep on touching your face just to adjust the mask without knowing yourself. And that increases for you to get the disease more. So wearing a mask is worse than not wearing a mask, really. But unfortunately, Indian government has passed out a mandate, and it is a mandatory thing for everybody to wear a mask. If you do not wear a mask outside in India, you will be stigmatized. So I would advise you, wear a mask when you're in India, and try not to touch your face.
Thank you for that. There's one more question. I know we are already on the hour, but I think there's this one more question which has popped in, and okay. I would still like to go ahead with that. So this question is, can a recovering patient who's recovering from COVID-19 have COVID-19 again? Can a reinfection occur?
There have been a few news about a few patients who had COVID-19 earlier within the last few weeks, and they got the disease again, unfortunately. Yes, it can happen. Once you have COVID-19, it doesn't necessarily mean that you will never have it again. There is a small percentage. We are not 100% sure what is the exact number yet, but it might happen. Yes, it's a truth.
Great. Thank you very much, Anirban. So with this, I would like to call it off or wrap up the session. So let me thank Dr. Anirban Ghosh for allowing us some of your valuable time and taking all of us here. From the Adi Shakti family and all of us who have joined here today, I thank you from the bottom core of my heart. Thank you very much. As for Gupshup, our next talk show would be on the Saturday, 2nd of May, on another very, very informative topic, which is nutrition. which will be presented by a very famous nutritionist, Mrs. Kalra. We will send out the registration links over public media, similarly like we did for this one. And we would expect all of you to join us on the 2nd of May, and let's do some gupshup. Till then, stay safe, stay alive, take care.
Thank you all.